This is a CT report from one of my patients that here says history is pulmonary fibrosis, signs and symptoms, pulmonary fibrosis unspecified, which in this case, this is a 50-something-year-old male that was a site worker that had damage to his lungs from radiation exposure. Now, this is not supposed to get better. Yet in the findings of the CT, it says there is no evidence of interstitial lung disease. This is from 2023, which is about 2 years after we injected this patient with stem cells. And in this video, I want to explain exactly what happened. Now, I've been wanting to make this video for a long time. This is probably take 12. And I finally decided to bag the script and just have a conversation with you. And I'm not gonna say wing it, but I'm gonna wing it. I know what I wanna talk about this. I had a video recently, I have a post on social media that's doing very well, that's talking about this case, and everyone's commenting regen on that video, and the video that I'm sending them has nothing to do, it's just a basic stem cell video, has nothing to do with things like COPD and pulmonary fibrosis, etc. So that's what the purpose of this video is. So if you hang with me, we're going to explain exactly how we do it. And it's actually very, very simple. In fact, the disclaimer will probably take longer than actually explaining how it works. You have to understand with stem cell therapy, they're not FDA approved to treat or diagnose any disease. So I'm not giving you medical advice. I'm just telling you what happened with this particular patient and many other COPD and pulmonary fibrosis patients that we've helped. I am a chiropractor in the state of Idaho. If y'all see my videos, you know that by now. I do have a medical staff that does these procedures for me. They're highly trained, they're overqualified. They do a dang good job of what we are about to talk about. So now that that's out of the way, if you don't know what stem cell therapy is, I'm not going to give you a definition in this video. There is a link below to another video that I made that is the top 10 questions about stem cell therapy. I highly recommend you go to that video and watch it first if you're new to this. If not, let's carry on. So here's where it gets interesting with lung issues. When we talk lung issues, we're talking about COPD, pulmonary fibrosis, long haul COVID, asthma, and bronchiectasis all respond very, very well to stem cell therapy. Now, one of the complaints, negative things that's out there about stem cells via IV administration, and that's what we're talking about, is putting stem cells into a vein and allowing them to go systemically. And when they do that, they are very anti-inflammatory. They've got awesome markers that tell your body to regenerate itself. They help modulate the immune system. And in these cases, they help people breathe a whole lot better. But the criticism is this. In the lungs, you have something called the pulmonary trap, which is the junction at the capillaries between the arteries and the veins, where oxygenated or deoxygenated blood grabs its oxygen and then heads off to your body to provide fuel. Now, people say that when you do IV stem cells, that the stem cells themselves get trapped in that particular space and stays there, which in the case of lung disease is awesome. That's exactly where you want them. So the short story here is when you are helping people with these particular issues, one of the most powerful things you can do is give them an IV of stem cells. Now, dosage is going to depend on how much degeneration it is. It's going to depend on how the size of the patient. So dosage is always different. But when you administer these stem cells via IV, they get cooked in that respiratory tract. They start knocking inflammation down. They start reducing scar tissue, and they start actually giving your body the signals it needs to repair itself. And that's exactly how this particular patient, I believe it was I should have gone back and looked. I believe it was 2 rounds of therapy with this, that this patient went from full-blown pulmonary fibrosis to that report literally says there's no evidence of interstitial disease, which is pulmonary fibrosis. So it helps heal that scar tissue. It helped regenerate that tissue. It helped him breathe well. And to this day, is doing very, very well. So that's how it works with all of these cases. Again, with COPD, with pulmonary fibrosis, with long haul COVID, with asthma and bronchiectasis, all you do is give these people an IV of stem cells and let them do their thing. And their thing, again, is reduce inflammation, break down scar tissue, and modulate your immune system and give your body the mechanisms it needs to start regenerating its own tissue. That is where the miracles happen. That is how we do it. If this applies to you, I'd love to chat. I'll leave you a link down below. Otherwise, make sure you like, make sure you follow, make sure you share this video because someone needs to hear it that's never heard it this way before. But that's what I have for you today. Again, this video's taken me weeks to make, and I think I finally nailed it, so I'm going to post that as is. I appreciate y'all, and I will see you on the next video.